Good evening and welcome back to the Woman Factor. The TGMC Center for Wound Healing offers specialized care for wounds or sores that do not heal properly. Chronic, non-healing wounds can have serious health consequences and may affect one's quality of life. With a specialized approach and trained medical staff, the TGMC Center for Wound Healing can speed up the healing process. So tonight, I am joined by nurse practitioner Laina LeBoeuf. Thank you so much for joining me.
Thanks for having me.
And we are going to discuss wound care and hyperbaric. So first off, can you please introduce yourself and just your role with TGMC?
Okay. My name is Laina LeBoeuf. I was a registered nurse for 17 years before going back to school to be a nurse practitioner. I've been a nurse practitioner for 9 years now, and 8 of those years have been in the wound care field.
And so now, what is the TGMC Center for Wound Healing?
It's a wound clinic where our goal is to identify and treat wounds that are not healing properly as quickly as possible before they can cause any further complications.
And so now, how exactly do patients know if they have a wound that isn't properly healing?
Anyone with a wound of any kind needs to pay attention to how it's healing. And typically we say that if a wound isn't decreasing in size by 50% in 4 weeks, there could be a problem. And wounds that aren't healing properly can become infected, which can make the wound much worse.
So now, do patients with diabetic wounds heal slower?
Yes, people with diabetes heal slower and are at greater risk for infection. And also, diabetic patients need to pay extra attention to their feet because they can get non-healing wounds on their feet as well.
And so now, why is it important for patients to go to the TGMC Center for Wound Healing for a wound that is not properly healing?
It's important to come to the clinic if a wound isn't healing properly because of the risk of infection. Infection can lead to serious health complications requiring hospitalizations as well as amputations.
And so now, how would one know if an infection is occurring?
There would be signs and symptoms, redness, swelling, increased discharge, odor, things like that.
And what type of wounds do you treat at the TGMC Center for Wound Healing?
We treat a variety of wounds there. We treat diabetic foot ulcers, venous and arterial leg ulcers, surgical wounds that aren't healing properly, burns, and pressure ulcers. We also soon will be treating wounds that are non-visible. For example, patients may undergoing radiation therapy may experience pain or bleeding from the bowel, bladder, or bone, and this will be able to be treated with hyperbaric oxygen therapy.
Wow. And so what differentiates the Center for Wound Healing from other doctors' offices that do these types of things?
Well, at our clinic, we have access to the most state-of-the-art wound care products and services. All we do is treat wounds at the clinic, and therefore we understand all the factors necessary to complete the healing process. And we also collaborate with various specialties that the patients may require, such as vascular specialists, surgeons, dermatologists, infectious disease doctors, and podiatrists.
Wow, I mean, that sounds like amazing that you guys are doing that.
Comprehensive wound care.
Yes, and so now what are some of the available treatments at the Center for Wound Healing?
Soon we will have the hyperbaric oxygen therapy, or HBO, which is a known, proven treatment to speed the healing process of wounds. Patients will undergo daily treatments of 100% oxygen delivered under pressure in specialized hyperbaric chambers. And the hyperbaric oxygen therapy increases the oxygen supply in the patient's bloodstream, tissues, and wound bed, which will speed the wound healing process and keep infection down to a minimum.
And so now, when is the hyperbaric service going to be available at TGMC?
It is anticipated to be ready to open mid to late December of this year.
And so now, can you just again explain the hyperbaric service? Like, how exactly, I know you kind of described how it works, but is it like a machine? Does it go directly onto the wound?
It's a tube, basically, that the patient's stretcher will fit into, and it closes securely behind them. And then the chamber is pressurized and delivers the oxygen, which just drives the oxygen into the patient's tissues and just saturates them with 100% oxygen, which will increase the healing of the wounds.
And how exactly does the oxygen help healing?
A lot of patients with diabetic foot ulcers and vascular wounds, their circulation isn't normal, And so they have trouble getting the proper blood flow and oxygen to their wound bed. So this helps drive the oxygen to where it is needed.
So the oxygen will actually help heal it faster?
It helps it heal faster, and it cuts down on infection.
Okay. I was just curious about that. And so can you tell us a little bit about the staff that works at the clinic?
Well, the staff consists of local nurses that they have dedicated their careers to wound healing, and together they bring over 25 years of experience in the wound care field with them.
Wow. And so how can people learn more or schedule an appointment at the TGMC Center for Wound Healing?
I guess the best way to call the clinic would be 985-873-4176, and they can call and schedule an appointment, or ask questions if they have any concerns.
Is there anything else that you'd like to add regarding the TGMC Wound Healing Center?
The best thing would be just anyone that has a wound that they're concerned about that just isn't looking right. It's better to come in sooner than later, and just have us take a look at it. And if it's no big deal, we'll discharge you and send you on your way. But if it's something we can help with, we're definitely there to help.
So now anyone has the availability to use this clinic?
Yes.
And you guys basically,
we take all insurances.
Awesome. And so now, again, I know that we had discussed the diabetic patients and how they have like a higher risk, and I have heard of that. And why is that?
They just have their blood flow is not normal. They have smaller vasculature, and they have neuropathy in their feet oftentimes, which means they don't feel their feet. So diabetics are strongly encouraged to never walk barefoot, and also to do daily foot exams on their feet at the end of the day, because a lot of times they won't even know they have a wound until they see blood on the floor or something. So it's important for them to really, take good care of their feet and do daily foot inspections. And
can you describe some of their wounds for some people that might not be aware of what they're dealing with?
Diabetics? They just get any kind of wound. It can start from often they have no idea how it started, and it just gets worse. And then when they have a wound and it gets infected, then their blood sugar goes higher because of the infection their body's dealing with. So it compounds the wound problem, because when you have higher glucose levels, you're not going to be able to heal the wound properly. So we work with the patient's primary care doctor to try to get their blood sugar under control as well as possible, and then, culture the wounds, check for infection, and come up with the most appropriate plan for them.
And so now, I know we had said, redness, swelling, smell. Is it the same for diabetics, or is it a little different or larger scaled?
No, it's wound infection is pretty much the same for any type of wound that we face.
And so now, again, what type of wounds do you guys treat?
We treat the diabetic wounds that can be on your feet or anywhere on the lower extremities. Venous and arterial ulcers, which venous ulcers are more for patients who have swollen legs. They get blisters on their legs and things like that turn into ulcers. So the treatment with that is a lot of compression therapy to minimize the swelling. And then the surgical wounds that aren't healing like they should, and pressure ulcers, which bed sores is the other name for that, and burns.
And now I also see, I know we talked about radiation injury wounds. Do people normally go to their doctor not knowing what's happening to them, and then they get kind of, brought to you?
Probably. These are patients that have cancer and are undergoing therapies. So I'm sure their radiation therapists are, telling them of things that can occur and what to look for and things like that. So when they do occur, thankfully, we'll be having the hyperbaric oxygen services available in December, which is a treatment to help them with that pain and discomfort they're experiencing.
And so once you guys get the hyperbaric, it's not a center, it's like a add-on.
It's actually, we're building a new wound clinic right now downstairs from where we are, and that's where the hyperbaric, there'll be 2 hyperbaric oxygen chambers in there.
And it's all going to be done in December?
It's going to be all ready in December. And it's going to be really good because we're going to share the suite with the imaging center, which is x-rays and different things like that. So patients that we see, if we feel that they need an x-ray or some sort of imaging, they'll be right where they need to be to have that done.
Right, and so you guys can kind of piggyback on that.
Exactly.
Well, that's going to be awesome, adding some new technology and a newer facility, because I know, it's always nice to renovate and to have that nice center for the new technology. And so thank you so much for joining me tonight. Is there anything else that you'd like to add?
No, I think we covered it all. Thanks for having me.
And how can we contact again about the wounds?
The number is 985-873-4176.
All right, and that's for the TGMC Center for Wound Healing. So thank you so much for joining me. Again, that is Laina LeBoeuf. And up next, we are going to have Dana Rogers with the TGMC Breast Imaging Center to talk about 3D mammography and breast cancer screenings. After that, we will have Heather Benoit, the president and founder of Moms Hope. And we'll also have Kim Thompson, the secretary for Moms of Hope, and they're going to talk about the Moms of Hope organization and Pregnancy and Infant Loss Awareness Month. Then we're going to have To Your Health with TGMC and Sports with Hillary Domingue. Also, we had breaking news earlier from the LHSAA on the penalty issued to Vanderbilt Catholic concerning the case involving Andrew Robinson. Hillary Domingue will address this controversy in the upcoming sports segment. Don't go away. We'll be right back with more on the Woman Factor.